So today we'll be studying about the skull. Okay. So basically, the skull is a bone, very big bone, comprising of many bones. Okay. So the primary function of this skull is to prevent the brain. Okay, that is the primary function of the skull. Other than this, is it correct that the skull also like allows us to eat and like to eat as well as to inhale air? Is that the function of the skull? To intake food as well as to inspire, expire? That is the function of the skull actually. Okay, basically this facial part is also a part of the skull only. Okay. Now, so basically the skull bone in total has 22 bones. In total it has 22 bones except the ear ossicles. Can you tell me the names of the ear ossicles? So malleus, incus and stapes. Okay, these are the ear ossicles. Now, so can you tell me where are these ear ossicles present? Hmm? Not in the inner ear. Middle ear. Okay, so the ear ossicles are present in the middle ear. So basically the primary function of this ear ossicles is that it modulates the sound. That is, the sound surrounding us is very high for our inner ear to accommodate. So what happens? It modulates the sound so that the frequency comes back to our normal frequency. That is our human frequency. Okay, so it is the function of these bones. So except these ear ossicles, all these, the whole skull comprises of 22 bones, and all of these bones are attached with one another by sutures. These bones are attached with one another by sutures. Okay, all of these are sutures except the temporomandibular joint that is connecting the facial skeleton with the mandible. So this is the mandible. This is mandible. This whole structure is mandible, and as you can see, it is connected by a synovial joint. So it is a synovial joint. That is why it is movable. Okay. So this is the mandible. Except this bone, all the other bones are connected with one another by sutures. Now coming to the parts of the skull. So basically the skull has two parts. One is your cranial skeleton, another one is your facial skeleton. As the name suggests, cranial skeleton is covering the cranium, that is the brain, and facial skeleton is this part. This is the facial skeleton. Now the cranial skeleton is again subdivided into your cranial vault. Okay. So this is your cranial vault. What is vault? Vault is a dome-like structure. Okay. Vault is a dome-like structure. So you can see in various Christian missionaries there are vaults now. So those vaults are similar to this. I mean, this name has been taken from there only. Vaults or domes. Okay. So this is a vault, and as it is present above the cranium or the brain, it is known as cranial vault. And this cranial vault is attached with this cranial base. This is the base. Okay. So this vault is attached with this base, and together they form the cranial skeleton. Okay, cranial skeleton. And this anterior part is your facial skeleton. That is the face, that is covering the face. All these bones comprise your facial skeleton. Now coming to the various bone parts. So as you can see, the skull has 22 bones in total, and the cranium has 8 bones in total. Out of them, 2 are parietal. I mean, the paired bones are parietal and temporal. Okay, these are your paired bones. And the unpaired bones are your frontal, occipital, sphenoid and ethmoid bone. Okay. So as you can see here, this is the cranial vault. Here you can see these 2 bones are paired. These are your parietal bones. Okay. And laterally here you can see another bone, one on each side, or I mean one on either side. These are your temporal bones. So these are paired bones. Temporal bones are paired, parietal bones are paired. Other than this large frontal bone is a singular bone, so it is unpaired. On the posterior side, this is the occipital bone, this is also unpaired. And inside you can see the sphenoid as well as the ethmoid bone. Okay. Some part of the ethmoid bone is present here. So here you can see the sphenoid as well as the ethmoid bone. So these are the 8 bones of the cranium. And other than this, there are 14 facial skeleton bones. Among them, the paired ones are your maxilla, zygomatic, nasal, lacrimal, palatine, and inferior nasal concha. And the unpaired bones are your mandible and vomer. So as you can see, the mandible is a single bone, so it is unpaired. And vomer is there in the nose, which is your here, somewhere here is your, I mean this is a, this is not a proper skeleton, so here will be your vomer. So vomer is your unpaired bone. And all of these topics will be individually covered in multiple classes, because the skull will not be covered in a single class. In your like head and neck, from your head and neck part, there will be from osteology part only skull and vertebra. Okay, that also only cervical vertebra. Other rest vertebrae has been covered, so only cervical vertebra and your skull. Other than this, hyoid bone is necessary, but it is not required for your curriculum. So hyoid bone will be skipped. Other than this, all other bones will be covered. So the skull will be taken in multiple classes. So today I am just giving you the introductory part. Now as you can see, as I have already mentioned, the whole skull is divided into your cranial cavity, I mean the cranial part as well as the facial part. Cranial skeleton and facial skeleton. This cranial skeleton is known as neurocranium, and this facial skeleton is known as viscerocranium. Okay. Now joints of the skull, I have already mentioned that all the bones of the skull are joined by sutures. So these are immovable joints. So as you can see, you cannot move these joints. So these are immovable joints. But you can move the mandible. That is why that is a movable joint. That is your at the temporomandibular joint. So basically, this is the temple region having the temple bone, and this is the mandible. So both of them are joined together at the temporomandibular joint. So this is a synovial joint which allows us to open and close our mouth. And all of these sutures are covered by sutural ligaments. So here you can see the parietal bones are connected by sagittal suture. So here is your sagittal suture. This longitudinal suture is the sagittal suture, which basically divides the, also you know na, sagittal section. What is sagittal section? Dividing the whole body into two halves. That is your sagittal section. So similar to this, in the midline is your sagittal suture, and the bone, I mean this joint that is separating your frontal bone and two parietal bones, that is your coronal suture. Here you can see the coronal suture is dividing the frontal from the two parietal bones. I mean joining all of these bones together. Here you will see bregma. This junction is known as bregma. Okay. And on the posterior side, this junction is your lambda. Here you will see in the occipital bone there is lambdoid suture. These are your lambdoid suture connecting the single occipital bone with your parietal bones. This is your lambdoid suture. And in between them, this part is your lambda, because it seems like, it looks like a lambda, na? Lambda sign. So it looks like a lambda sign. That is why it is known as lambda. So, and in the frontal bone, in this frontal bone, sometimes there is another suture present here, which is your metopic suture. Okay, metopic suture. Now the anatomical position of the orbit has to be like that. I mean of the skull has to be like that. The orbits should be facing forward, and the lower margin of the orbit or the infraorbital margin, if I draw a, a like line from here at the infraorbital, imaginary line from the infraorbital region, it should pass through the upper part of the ear ossicle. See here, that green line is passing through the upper part of the ear ossicle, not ear ossicle, external auditory canal. So this is the external auditory canal. This green line is passing from the below part of your orbit and above of your ear, I mean external auditory canal. Can you tell me what is external auditory canal? Basically your ear canal. So your ear canal is your external auditory canal. So a line passing through the lower part of your orbit and the upper part of your external auditory canal is like determining the anatomical position of the skull. And there is another imaginary line, that is the Riddle's line, that is basically passing through the middle part of the external auditory canal or your ear canal. that is your radial spine, but that is not any significance from the point of view of anatomical position. The Frankfurt's line is that line that is determining the anatomical position. That is the green line passing through the lower border of your orbit and the upper border of your ear canal. Now there are various parts of this skull. So the whole skull, usually during our times we used to study the individual bones, that is the frontal bone, parietal bone, occipital bone separately, then the sphenoid bone, but now the whole skull is divided into various norma. So here you will see norma verticalis. This is the norma verticalis. The anterior part is known as norma frontalis. Norma frontalis. The whole anterior part is known as norma frontalis. The posterior part of the skull is your norma occipitalis. The basal part is your norma basalis. And the lateral part is your norma lateralis. Again, the superior part is your norma verticalis. The frontal part is your norma frontalis. Lateral part is your norma lateralis. And posterior part is your norma occipitalis. And basal part is your norma basalis. Okay? These 5 parts. So this is the norma verticalis part. Here you will see the bregma as well as the lambda. Okay. So it will be covered in a separate class. The norma verticalis will be covered in a separate class. Here you will see all the sutures that I have already described. Here you can see the metopic suture that is present in the frontal bone. It is not present always. Okay. It is present in some of the individuals, this metopic suture. This is the norma occipitalis, or the posterior part of the skull. Here you will see this occipital bone connecting with the parietal bones at the lambda. And here you can see the lambdoid sutures. Here you can also appreciate the mastoid process. So basically this hard bone is your mastoid process. Okay, this is your mastoid process. This mastoid process is attached with this occipital bone at the occipitomastoid suture. I mean by the occipitomastoid suture. In this mastoid bones, this hard bony structure, there are certain air cells. So air fillings are there. So whenever we need to enter into the inner ear or sometimes in the middle ear, we approach through by drilling this site. Okay, there are certain guidelines known as such as Donaldson's line, leave it. So here through this we approach into the middle ear for clearing any fluid or for other purposes. Now this is the norma frontalis. Here you will appreciate the frontal prominences and superciliary arch and the several bones of your face. Okay, basically the frontal prominence is very much important. So glabella is this part, Nazian, glabella, everything is present in this location. So these are various, anatomical marks, like these are certain anatomical surface marking from where we measure various things. Now this is the norma lateralis. Here you will see one important structure, that is terion. Terion is the junction between your parietal, frontal and temporal bone. Okay, it is the junction between all these bones, and under this terion is one important structure of brain, artery is present, that is your middle meningeal artery, that is present just below the terion. Okay, so there is one type of hemorrhage, that is your extradural hemorrhage, which occurs due to this middle meningeal artery injury. Okay, so it is present just below the terion. Now this is the norma basalis part. Here you will find multiple foramens such as foramen rotundum, foramen ovale, foramen spinosum, and all of this foramen carries multiple structure entering the brain as well as coming out of the brain, such as your all the cranial nerves, then your arteries such as accessory meningeal artery, middle meningeal artery, all of these structures enter the brain, as well as some of the veins also come out through this foramens. So all of these foramens has to be studied again. So all this norma will be taken in multiple classes. Now, so the difference between a male and a female skull is that, so there are certain differences between the genders. So there is certain table given in your book differentiating the male and the female skull, but for convenience, like there is a rule of thumb is that everything will be larger, wider, broader in case of males. Okay, everything will be large, wide, more prominent in case of males, but in case of females, the frontal bone will be more prominent. Okay, this frontal bone will be more prominent in case of females. This chin will be more prominent in case of females. Orbits will be more prominent in case of females, and the angle of mandible will be more than 120 degree in case of females. Okay, these are certain important parts. Then frontoparietal eminence is there between the frontal bone and the parietal bone, that will be more prominent in case of females, and rest all other things will be more prominent and enlarged in case of males. Now coming to newborn skull. In newborn skull you will see that this facial skeleton is very small. You will see that the head of the baby is very big. So in a newborn the facial skeleton will be smaller, almost 1/7 of the total skull. Okay, and rest 6/7 will be this cranial skeleton. That is the important difference of a newborn skull from a adult skull. So these are the important points regarding the introduction of skull.